everyone, this is Marika and welcome back to another session of Community Health Nursing. In our previous sessions, we have discussed about what is community health nursing, what are the principles of community health nursing, and we also discussed about dimensions of health and health promotion. So in this session today, we are going to discuss the remaining aspect of health promotion. In our last class, we have discussed about what is health promotion, how health promotion can be achieved successfully in a community, and what are the aims and prerequisites of health promotion. So let us quickly recall what health promotion is. Health promotion can be defined as any activity that is carried out by an individual. Any activity that is carried out by an individual which is aimed at well-being of an individual can be termed as health promotion. So any activity that is done by an individual which will contribute positively towards the health of an individual can be termed as health promotional activities. Health promotion is the way through which community health can be achieved, and health promotion says that there are two different behavior in an individual in a community. So as we take an individual, we can see that an individual may have some negative behaviors such as drinking alcohol or smoking, which might have the negative impact on the health, and the individual may have positive behavior such as taking proper rest and sleep, adequate nutrition, exercising and staying physically fit. So these are the positive and negative health behavior of an individual, and this health behavior contributes to the well-being of an individual. In health promotion, we as healthcare professionals help the individual to understand and adapt to healthy or positive health behavior. We've also seen that there's only one aim of health promotion, that is to achieve the overall well-being of an individual, which includes physical, mental, social, and spiritual well-being of an individual. And we have also seen the three main prerequisites of health promotion, which is education or educate, enable, and mediate. I hope all of this that we have discussed in the last session was clear to you, and in this session today we are going to discuss the remaining aspect of health promotion, which includes the principle of health promotion, a process of community development, and the target group of health promotion, and finally the target group of health promotion. So we have already understood that health promotion is any activity that is carried out which will contribute to the well-being of an individual. Let us directly see what are the principles of health promotion. So the principles that we are going to discuss now is the principles of health promotion given by the World Health Organization in the year 1984. The first one is health promotion involves the community, the people as a whole. It does not focus on the people who are at risk of a specific disease, but rather it focuses on people or all the individuals in a community. Now, as I already said while we started dealing community health nursing, the healthcare delivery system was earlier focused on institutionalized care, which means only when patient falls sick, come to the hospital for care was provided to the patient. But now the focus of health or the focus of healthcare delivery system has shifted to providing care in the community, which means in the community, even if people are not at risk of certain disease, or even if people are not suffering from any kind of disease, people are given health education, people are taught about ways of preventing diseases, self activities that can help them protect themselves from any kind of disease. So health promotion is not the services that are provided to the people who are at risk or who can develop illness, but rather it focuses on every individual in the community as a whole. Again, in community also, there is a chance that as a community health nurse, when we go for home visit, we find out that people are at risk of specific disease. Of course, those people are the priorities. The people who are suffering from certain kind of illness or who are at risk of suffering from any kind of diseases are the priorities. But in health promotion, we do not focus only on those people who are at risk, but the people of the community as a whole. The second principle is that health promotion is directed towards the action on determinants of health. So health promotion also focuses on not just the physical dimension of an individual, but all the dimensions of the health. Another principle of health promotion is that health promotion includes various different aspects to provide care to the people, which means healthcare is not just focused on providing health care, but it includes providing education, communication, organizational changes, community development, and other methods through which the health promotion can be achieved. Another principle is that health promotion focuses on public participation, or health promotion requires active participation from the public. For us to provide effective health care to the people in the community, of course, we need community participation. We have already discussed this in the last session, wherein we have seen how important community participation is. So health promotion is not focused on healthcare people going communicating about healthcare matters and providing care as needed by the people, but also involving people actively in healthcare services. Another principle of health promotion is that health promotion cannot be considered as a medical service, but it is considered as a combination of health and social field. So in health promotion, rather than calling health promotion as medical services provided to the people, health promotion is a combination of health services and social field services. Even though it is not a totally medical service and a combination of health service, and it requires collaborative effort and it requires a lot of effort from healthcare professionals, especially those who are working in primary health center. So people in primary health centers work in close relationship with the individuals in the community, and therefore it is easier for them to reach out to people as well as provide care or provide healthcare services to the people. Therefore, people or healthcare professionals working in primary health centers plays a major role in health promotion, but we cannot consider health promotion as a total medical service. Rather, it is considered as a combination of health as well as social services. These are the major principles that are given by World Health Organization in the year 1984. There are also other principles of health promotion. Let us see what are those. The first one is create supportive environment. So a healthcare professionals, people who are working towards health promotion, must work towards creating an environment that is supportive, that is helpful for the people in the community. Therefore, as a person, as a healthcare professionals, we must understand the need of the community and help them create an environment that will support them, that will support their health needs. The next principle is strengthen community action. Now, what is the meaning of the term community action? Community action is any activities that increases the empowerment, understanding and engagement of community. So we have to strengthen the community action. That means the community people must be spoken to, they must be communicated by healthcare professionals in order to make them understand what health services are available, what are the various factors that may affect the health of an individual, what is health behavior, and also what are the various factors that will contribute positively towards the promotion of the health of an individual. So we have to strengthen community action. What is community action? Community action is any activity that is carried out in order to empower, in order to engage, or in order to any activity that increases the understanding, empowerment, and engagement of the communities. Now, all of this is done for the delivery of health services. So people has to understand, people has to know about, and people has to be engaged in the healthcare delivery system, in the healthcare delivery, in the delivery of local services. Another principle of health promotion is develop personal skills. So as a healthcare professionals, when we are engaged in providing care to a community, we must make sure that our personal skills are developed. We are good as a person and we are in the position to provide healthcare services to the community people. So these are the various principles of health promotion. Now let us see a concept called a health field concept. According to health field concept, health promotion is affected largely by lifestyle, environment, and health services. So there is a concept of health that is called as health field concept, and this concept says that health promotion is majorly affected by lifestyle, environment, and health services. And out of these three, lifestyle, environment, and health services, the environmental factor plays the major role in the health promotion. Now, environmental factors obviously include physical, biological, and social factors. Now, as we know, some of the factors, some of the environmental factors as being interactive or being social to people helps the person to stay healthy, whereas isolation or poor interaction with people around may lead to risk for certain ill health. So, environmental factor out of the three factor plays a major role. So, a health field concept is a concept of health that says that there are majorly four different factors, and out of the four, one is usually not taken into consideration. The first factor, as you can see here on the screen, is lifestyle and behavior. The second factor is genetic composition. The third factor is environment, and the last factor is health services. So genetic composition is not taken into consideration in health promotion, but it is believed in health field concept that these are the various factors that affects the health of an individual and that also affects health promotion. And out of all these factors, environmental factors plays the major role. These are the major four factors according to health field concept, which affects health as well as health promotion. Let us now see health promotion as a process of community development. How health promotion helps in community development, or why health promotion is considered as a process of community development. When we talk about community development, it involves working with the people in rural area, people who are deprived of healthcare services, people who do not have the advantages to various health services, and also to a group of people who might be resistant to certain health services, right? So community development does not happen when we communicate with the leaders or the influential people of the community. It involves working with the people who are in rural area, who do not have the advantages, who do not have the facilities to health services, and also maybe with resistant group. Now, community development, one of the major aspect of health promotion. Health workers are employed in the community to make sure that health workers works together with the people in the community, to make sure that the people in the community work with one another. The health workers are employed to work in community level with the people in the community. They are supposed to work with the people in the community. So what are the tasks that are given for health worker, or what should the health worker do when working in a community, when they are working in close relationship with the people in the community? The main task of the people from the healthcare profession is to make sure that they help the people identify their needs. Now, as I said, it is not always possible to work in urban areas, to work with people who are educated, or to work with people who are supportive to healthcare services. As we work in rural area, as we work with people who do not have enough education, we might face many resistance from the people as well. So healthcare professionals are employed in communities so that they have to work in relation with the people in the community, and it is their task to help the people identify the needs or the health need of the people. So it is the task of healthcare professionals to make sure that they are able to communicate with the people in the community. They are able to make the people understand the health needs of each and every individual in the community. Another task of healthcare professionals is to make sure that they provide adequate education to the people in the community. It is the responsibility of healthcare professionals to make sure that people in the community are aware about various factors, various health related matters. And it is not just about providing education, providing health education to increase their awareness, to create awareness, but also performing various healthcare activities, performing various activities people understand about health and health related matters. So healthcare professionals are not just there to make sure people understand their health need, but also they are there to provide health education, to provide education to the people, carry out activities for the people so that they understand the importance of health and also the importance of health promotion. Now, what is the necessity for a healthcare professional to make sure that they perform activities, that they provide education to the people in the community so that the community people understand the importance of health behavior and also bring changes in the negative behavior that they have? So, as I said, the behavior of an individual can be negative health behavior or it can be positive behavior contributing positively towards the health of an individual. So, if there are any kind of behavior in an individual which is causing harm to an individual, it is our responsibility as healthcare professionals to provide education to those people and make sure that they adopt healthy lifestyle, that they are motivated enough to bring those changes in their day-to-day life. So that is how we can have a proper community development. So health promotion is not just focused on providing care to the people who are sick, but it involves educating the people, carrying out activities in the community level, working with the people closely in order to make sure people understand the importance of health and they understand what are the ways through which they can protect themselves from any kind of illnesses or diseases. It is not about helping the people just to restore their health, but also maintenance and promotion of their health. That is how health promotion is considered as a complete development of a community. Let us move on and now see the target group for health promotion. So obviously, for carrying out any kind of activities, we need to have a group of people who are the target, who are actually targeted for providing education or for carrying out any activities. Now, a target group can be considered as a group that is selected by healthcare professionals after a thorough plan. Target group helps the communication of any kind of health message to reach out to people in much better way. Therefore, we need to have target group when we even consider health promotion or when we want to have a community development. When we have a target group, we can also understand the effectiveness of our education. We can understand the effectiveness of the activities that we are carrying out as a healthcare professional. Therefore, as a major aim of WHO, which is health for all, we need to have target groups and health promotion must be provided. Health promotion, communication of health promotion, education about health promotion must be given to target groups in order to ensure that health promotion or health for all can be achieved. The very first target group of health promotion is workers at workplace. Now, what does workers at workplace means? A person, a group of people who work in a certain organization. In their workplace, we provide education related to health promotion to the people working in one single organization. So one workplace is selected and the target group in that workplace are all the workers in that particular workplace. Now, why workplace or why workers in their workplace? Chooses or selects workers in their workplace to provide education about health promotion. There are reasons why for health promotion workers at workplace are chosen. Let us see what are those. The very first reason why workers are selected at their workplace for health promotion is that the people in a particular workplace have captivative personalities, or they can be termed as captivative population. And we as healthcare professionals, when we provide education about health promotion to people like that, they'll understand it in a better way. They'll also put it into their practice. Therefore, the first reason why workers in workplace are chosen for health promotion is because they are considered as captivative population. The next reason why workers in workplace are selected for health promotion is because in a workplace there is a proper channel of communication. So we as healthcare professionals, when we go reach out to the people in their workplace, in their work environment, we get a proper channel of communication, because of which our communication, our education becomes much more effective. The third reason is also physical facilities. So in a workplace, there are all different physical facilities which will ensure that healthcare providers will be able to conduct any kind of health promotional activities in the given environment itself. The next reason is because of availability of resources. So resources in a workplace will be available in abundance and it can be used to provide or to communicate or educate the people in the right way. Another reason for which the workplace is selected and the workers are the target group is because it is easy to do follow-up. Now, when we have a proper place wherein we know that we will meet this many number of individuals in the workplace, it becomes much easier for us to administer the education. It becomes much easier for us to communicate the message, and also it becomes easier for us as healthcare professionals to follow up as well. We can go and see the progress in the people's health. We can go and see if people are practicing it in their day-to-day life or not. So it becomes very much easier for follow-up as well. The health promotional activities can be beneficial for the employer and it can be beneficial for the employees as well. Let us see how is it beneficial for the employer first, and then how is it beneficial for the employee as well. The first benefit for the employer is that the burden on employer of rising cost of health is reduced. When healthcare professionals itself are reaching out to the workplace, the burden on the employer, which includes the rising cost of the healthcare services, is decreased. The employers are getting a chance to provide healthcare services to the employees in their own workplace. So therefore, the burden of rising cost of the healthcare services is decreased. That is the first benefit for the employer. Another benefit for the employer is that it develops a caring image of the employer in front of the employees. So of course, as an employer, if I allow certain healthcare professionals to come and to carry out health promotional activities for my employees, obviously the employees will have an image of the employer that he is a very caring employer. So it will develop a caring image of the employer. The next to benefit for the employer is that if health promotional activities are taught to the employees and if they carry out health promotional activities, it is obvious that the risk to certain diseases are reduced. Therefore, there will be decreased absenteeism. So the number of leaves that are taken by the individual in the working environment will be decreased as they are provided with various ways of promoting their health. It will reduce the risk of developing an illness and therefore it will also reduce or decrease absenteeism. The next benefit for the employer is, of course, if there is decreased absenteeism, there will be increase in the productivity of the workplace. So these are the various benefits of health promotional activities carried out in a workplace for the employer. It will decrease the burden of cost on the employer. It will also help the employer to develop a caring image. It will help the employer to increase the productivity in the workplace and also decrease absenteeism in the workplace. Now, there are also benefits for the employees. The very first benefit is that it saves time for the employees as they do not have to travel to visit to a healthcare center or for healthcare services. They are getting healthcare services, they are getting various health promotional activities and various services in their workplace itself. So they do not have to travel to locate healthcare services, therefore it saves their time. The next benefit for the employee is that as they are under assessment, as their needs are assessed, as the problems are identified, care is provided, services are provided to the employees. The money that is used for the treatment of the disease also is decreased, as well as they are also able to save money for transportation. The money of transportation that they might have used to travel from their place to a hospital or to a healthcare setup is also decreased. Another benefit for the employee is that there is decreased stress in the working environment. Once their needs are identified, once they know that they have no health problems, it is obvious that the stress of an individual is decreased. So for employees, the stress will also be reduced. So these are the benefits for the employer and the employees. Now let us see what are the activities that we as healthcare professionals can carry out for the people at their workplace. The first thing that we can do as healthcare professional is health assessment. So we have to perform health assessment in order to see the health of each and every individual in their workplace. We have to assess the health of each and every workers in the workplace to understand the health status of an individual. The next activities that can be carried out for the employees in our work environment is stress management. So when we work, it is obvious that we will be under some kind of work stress. So to reduce the stress as well, healthcare professionals can play a major role in health promotional activities and teach the people, educate the people about various stress management methods. The next activity that can be carried out is prevention of accidents. So obviously we all have to travel from one place of another. We all have to travel from one place to another, and there are chances that we might meet with any kind of road traffic accident and other accident in even other types of accidents even at our home. So prevention of accidents can also be taught to the people in the workplace so that they understand how an accident can occur, how they should what they should do and how it can be prevented. Another activities that can be carried out in the workplace is helping the people understand the nutritional needs of our body. So all the people might not be aware about the nutritional requirement of our body. Therefore, in workplace, when we visit the people in the workplace, we can teach them about the nutritional need of the body. We can also perform nutritional assessment and identify if there are any nutritional problems in the people working in that particular place. Another activity that can be carried out in a workplace is teaching the people about harmful effects of smoking or drug abuse. So in workplace, we might find many people who may be into smoking or maybe into various behaviors that may cause harm to their health. Therefore, as healthcare professionals in a workplace, we can teach the people about smoking and prohibiting smoking, how smoking is a risk factor for certain diseases, and what are the ways through which smoking can be avoided. Similar to cigarette smoking, drug abuse and alcohol abuse and the ways to overcome such abuses can also be taught to the people in the workplace. And finally, the activities that can be taught in workplace is about exercise and fitness. Now, exercise and fitness is the major aspect in today's world. And when we go to a workplace and visit the people in their workplace, we get to understand about their fitness, and we can also teach them about various exercises that they can do in order to remain fit. So the first target group are the workers in the workplace. And we have discussed the various benefits for the employer as well as for the employee, and what are the activities that we as healthcare professionals can conduct in the workplace. Let us see what is the second target group and what activities can we conduct for the second target group. The second target group is adolescent. Now, obviously, there is a need for providing health education. There is a need for assessing the health needs of an adolescent as they change, or as there is a development in their body which is physiological. There are so many changes that a person undergoes from the time that a person is a child to the adolescent. There are physical changes, there are reproductive changes that are seen in this particular age. Adolescents are seen to be influenced easily by various social, environmental, and economic factors as well. And there is a need for providing health promotion to the adolescent, as they have a behavior, or they have the tendency to develop risk-taking behaviors and adopt habits that are unhealthy for them, such as smoking or such as getting into alcohol or drug abuse. So adolescence is a phase where we see many changes in the body of an individual, physically as well as physiologically. Therefore, this period of time is very crucial, and there is a need for health promotion, and the adolescents are to be selected as a target group for providing various health promotional activities. So let us see what are the activities that can be carried out for an adolescent to reduce the risk or to help the adolescent adopt a healthy lifestyle. The first thing to do, or first activity that we can do, is to help them understand about behavioral and lifestyle problems. To reduce behavioral and lifestyle problems can be one of the activities that are to be cut, can be one of the activities that can be carried out for adolescents. The next activity that we can carry out for adolescents is to help them understand and help them prevent from any kind of risk-taking behaviors, such as reckless driving or indulging themselves in any kind of sexual activities. So we as healthcare professionals must provide proper education on various topics to adolescents to help them understand how it can cause harm to the health of an individual and how they can promote their health. In order to provide health promotion, or in order to carry out health promotional activities for the adolescents, we need a collaboration from the educational institution, from the parents, and also from the community. Whatever strategies that we use in health promotion to promote the health of an individual should be acceptable culturally, as well as acceptable for the individual and communities. So as healthcare professionals, we must also understand the cultural and various beliefs and values of an individual and of the community, and then only plan for the health promotional strategies. Activities that can be conducted for adolescents include education related to developmental changes in human body. So we can provide education to the adolescents about what are the developmental changes that can be seen from the childhood to an adolescence. What are the various changes that they are undergoing, or what they might undergo, can be taught to the adolescents and also to the parents and other people in the school. They can also be taught about disadvantages of sexual practices, especially unprotected sexual practices. Various disadvantages of unprotected sexual practices, such as unwanted pregnancy or transmission of STD from one person to another, all of this must be taught to the adolescents. The third activity can be education on nutrition. So adolescents must be taught about the nutritional requirements of the body, how they should follow a certain nutrition, and how nutrition is helpful role in helping them to promote their own health. Another activity can be conducted on accident prevention. As we discussed for the first target group, accident prevention is a part of everybody's life. It can be a part of anybody's life. So accident prevention can be taught to the people, especially to adolescents. It is taught because adolescents, as I said, are involved in risk-taking behavior such as reckless driving. Therefore, prevention of road traffic accident is one of the major aspect or major activity that can be taught for health promotion. Another activity that can be carried out is to educate the adolescents on healthy lifestyle. So what are the healthy lifestyle, what they are supposed to do, what will contribute positively to their health, and what are the various factors that contribute negatively to the health must be taught to adolescents. Another activity is to educate the adolescents about emotional and mental health. So especially in our country, in India, we do not have any kind of awareness about mental health. Therefore, it is necessary for us to provide education on people, on adolescents, especially about emotional and mental health. Health assessment can also be conducted for adolescents. Of course, adolescents are at need of health assessment, and it can be conducted as an integral part of healthcare system. And it can be conducted as an integral part of health promotion. Education on hygienic environment, hygienic condition must also be provided to adolescents. They must be educated about how to maintain their personal hygiene as well as environmental hygiene. And finally, we can also conduct activities such as counseling and physical exercises. Adolescents must be taught about how to stay fit, or what are the various exercises that they can perform to stay fit. So all of these activities can be conducted for adolescents. Adolescents are taken as a target group because they have the tendency to develop risk-taking behaviors and also indulge into various behaviors that may contribute negatively to their health. Therefore, all of these activities will help the adolescents understand about health and also contribute towards health promotion. Next one, we have elderly. So of course, elderly are also one of the target group for health promotion. We are talking about health for all. In order to achieve health for all, elderlies are to be taken into consideration and not ignored. Health promotional activities are carried out for elderly people in order to make sure that they gain independence, that they are able to carry out various activities independently or also contribute to self-care activities. So as people grow old, they start to become dependent on other family members. They start to become dependent on other people. Sometimes elderly people are not able to carry out the task, and it sometimes becomes a way of living for them. But those elderly who are capable of performing their own activities must be taught about various ways through which health promotion can be achieved. Health promotion for elderly mainly aims at helping the elderly gain independence in various activities, day-to-day activities that they perform. Now, elderlies may have problems, they may have illnesses, chronic illnesses, and they may have age-related problems and various nutritional problems as well. As an elderly person, the person sometimes may not be able to eat adequate food, the person may not be able to perform any kind of exercises, and they may also have various non-communicable diseases. So all of these factors affects negatively to the health of an elderly. Especially when people suffer from any kind of non-communicable chronic diseases such as cancer, diabetes mellitus, or hypertension, there is a need for them to carry out certain activities that will help in health promotion. The next target group that we have is women and children. The last target group is women and children. So women and children are also one of the major target group of health promotion, and women's health must be focused, especially the reproductive health of a woman must be focused on while health promotion. Women must be empowered, they must be taught about things, they must be educated about various health related matters, various strategies through which health promotion can be achieved. And it is believed that when a woman is empowered, they are capable of changing things around them, especially related to health. According to Godman and Heath, they say that most of the women in this world live longer than men, but they suffer from many diseases, or they suffer from higher rate of diseases. Women experience greater morbidity, but they live longer than men. When women are provided with right kind of education, when they are empowered, they are capable of bringing the changes in themselves. They are capable of adapting themselves to the changes in the environment, as well as they are able to understand what they should do, what they should not do, what they should avoid, and what is the right way to keep our health promoted. This is the reason why women are taken as a target group for promotion of health, because women are capable, with right empowerment, women are capable of changing things around them. Now, for women in health promotion, we focus on decreasing the maternal morbidity, maternal mortality. How can we achieve a decreased rate of maternal mortality? By providing right amount of antenatal care, by providing effective antenatal care, clean and safe deliveries, nutritional and welfare services to the woman, and nutritional and welfare services for the woman, which will help to improve the health or the reproductive health of a woman. For children, health promotional activities include providing vaccination, weaning, right amount of nutrition, monitoring the growth and development, and education of the children. So these are the target groups, and these are the various activities that can be carried out for the target group. To summarize, today we have discussed about health promotion. In this, we have discussed the principles of health promotion, we have discussed about the strategies of health promotion, and we also discussed about the target group of health promotion. We discussed health promotion as a process of community development as well. I hope the class was helpful, and I'll see you all in the next session where we will discuss about legislative approach of health maintenance, legislative approach of health promotion and health maintenance. Thank you and have a great day ahead.